And now taking a look at the legalization of marijuana for medical purposes, using it to help relieve patients suffering with chronic pain. Is this a legitimate use, a potentially growing use? Joining me now with more is Dr. Devi She's assistant professor at the NYU School of Medicine. Dr. Devi, it's great to see you.
Great to see you too.
I was just personally curious about this with the recreational use and sale of marijuana now okay and legal in Colorado. Is there a legitimate medical use for marijuana with roughly 19 states of the lower 48 making it legal for that?
Yeah, so there's a huge difference between recreational use and medical use. I mean, there are studies that show that marijuana can be helpful for certain conditions. It's been shown to be really helpful in cancer-related pain and nausea. Same thing with AIDS and multiple sclerosis. But the danger here, I think, is that a lot of people want to use it recreationally, but they might be trying to get it through this medical kind of bypass route.
Which is clearly happening.
Exactly. So, I mean, normally if you go to the doctor and get a prescription, the doctor tells you, take this much, take this often, and for this long. I mean, right now, doctors don't have a guideline to be able to do that because there aren't enough studies. It's not FDA approved. So you don't really have a way of giving patients risks and benefits and really explaining whether it's going to help or not.
Do you think those studies are coming? Is there an attention in the medical community on discovering better ways of using marijuana for pain management?
Yeah, so some of those studies are already being done. Some have been done in the past, and actually we have a prescription pill form of marijuana, which a lot of people don't realize. One of them is called Marinol, another one is Sesamet. There may be others also in other countries, but those are already out there. So that's some of the controversy in the medical community, because right now, if you have those pills available, only certain physicians can prescribe them. It's not everybody that can do it. And if they're available, then people who need it can get it, And is
it used for the same things? Is it used for cancer-related pain or AIDS-related pain? Is it the same? Is it prescribed in the same way that just smoking medical marijuana would?
Well, it's prescribed, but it's got more guidelines, right? So in terms of smoking marijuana, I mean, the other thing to think about is, there are different types of pain. So we're talking about cancer, but just think about if you come out of surgery, for example, you're going to be better off probably with a shot of IV morphine than, having someone pass you a joint, right? So we really do need those studies to separate out what types of pain it can be helpful for and what types of pain it might not be helpful for.
What area of focus needs the most attention in terms of developing new drugs or figuring out applications of drugs to treat pain? Is it lower back pain? Is that the most common form? And tough to treat form of pain?
Yeah, that's the most common form of pain that I see. So most people have some type of musculoskeletal pain, whether it's low back pain or arthritis. I mean, we're always looking for treatments and cures for that, but we haven't found one so far, right? There's no cure. They're just things that can help with the symptoms. So the idea that marijuana might be a cure-all for all of these musculoskeletal problems, I think that's a little bit naive, We should do more studies. We should continue to look for the treatment, but I don't think we can expect that. And one of my biggest concerns with this is because people are turning to the medical community, I mean, it's sort of unfair. It's inherently unfair. If you have a doctor who'll prescribe you marijuana and you get caught with it, then you might be all right. But if you have marijuana and you have pain and you did it on your own, then you might get arrested, right? And that could change your whole future. So
a very important point. And also, you have the drug community struggling with the abuse of legal, legitimate painkillers that are on the market. So it becomes even more tricky when you bring marijuana into the
Well, that's my worry. There's two. I mean, we already have problems with things like OxyContin and stuff. I mean, it's gotten so much bad publicity. These medications can be helpful for certain people, so we don't want them to go away. But at the same time, because they've been harmful to others, people have so many concerns, and we don't know what's going to happen with marijuana in the future. My other concern is people who have pain, especially severe pain, they're already on medications usually. This is not the first thing that they're taking. So we don't know how marijuana interacts with all these other drugs.
Again, the lack of studies, too. Dr. Devi, it was great to see you.
Oh, great to see you, too, Dagen.
Dr. Devi Nampia.
Perfect.
I rehearsed that. You have no idea how many times I said your last name. It was great to see you. We'll see you very soon. Come back and we'll talk about the Affordable Care Act.
Oh, great.
We can do an entire show about that. Thank you again.
Thanks.